And good morning, and welcome to a special community profile program here on WCSL 1590 AM, 92.3 FM, and KTCBroadcasting.com. And we invite you to tell your friends and neighbors to tune us in today, because today is a special call-in day. If you have any questions for our guest here today, and our guests are from the City of Cherryivlle and Gaston County Emergency Management team, Jeff Cash. Good morning, Jeff.
Good morning, Milton.
And from the medical community, Dr. Tom White from Cherryivlle. Good morning, Dr. White.
Good morning.
Good to have you guys back. We were here last week to talk about the coronavirus and the impact it's had and on the community, medically and economically and so forth. We didn't take calls at that time last week because we really hadn't discussed taking calls, but that topic did come up, and we are welcoming your calls. But first, I'll ask Jeff Cash and Dr. White to kind of give us an update from their various perspectives on what's been going on in the last week regarding COVID-19, or as it's also called, the coronavirus. Jeff?
Thank you, Milton. Appreciate the invite. First of all, I'll give you an update from the city's perspective. We have scaled back our operations and only trying to do those services that are absolutely necessary. You know, public safety, police, fire, and we're looking to continue to do our garbage service, as well as, of course, the water plant and the waste treatment plant. But large debris pickup, access to City Hall has all been limited. We have about 80 full-time employees, and only about half of them are in position on a daily basis. The other half are rotating to try to keep the social distancing and just to try to eliminate so much traffic and closeness among city employees. Every crew that has responsibilities, water line breaks or anything, they're all on standby to come and take care of those issues. However, City Hall is closed. You can call and get an appointment if you need to see the planning and zoning director, Derek Mackey, or one of the utility ladies up front, or our utility director, Miss Dixie Wall, or myself. And we will be closed this Friday and Monday for the Easter holiday on Friday, and then Monday for a COVID day totally. That'll give us 4 straight days that City Hall and most city facilities will be uninhabited, to just make the virus go away that much quicker.
Yeah. Obviously, nothing like this ever. This is all unprecedented, all new territory for the city governments, county governments, etc.
Yes, it is difficult circumstances, and we're trying to meet those challenges to the best of our ability. At the same time, keep our employees safe.
Where do things stand at this point? Of course, the state under the shelter at home order from the governor, so that supersedes the previous order from Gaston County that limited travel and so forth. So that's all been superseded by the state order, right?
Yes, whichever ordinance is more stringent is what applies. For example, if Gaston County has something more stringent, it kicks the states to the second level, and vice versa. And even the federal guidance can take precedent over local and state. But just to give you some numbers update, I did a check yesterday. Most of the CDC, and the CDC is the Centers for Disease Control, and it's based out of Atlanta, Georgia. And the total cases were 891,000 cases. Total deaths, just under 9,000 deaths. And that's in the U.S. picture as a whole. So I broke it down a little closer to home. There have been 33 deaths in North Carolina. Lab cases confirmed, 2,800 of those. There have been 40,700 tests administered. Currently in North Carolina, 89 counties of the 100 are effective, and there's 270 people hospitalized. And there is a small number in nursing homes, small number in residential facilities, and even a smaller number in correctional facilities. It's mostly the general public. So that's kind of an update for the nation and the state, and of course with New York being the most devastated, and Louisiana running a close second place in the number of cases and deaths.
Okay, thank you, Jeff. And Dr. White, good to have you back with us. from the medical side of things, what has changed? What do we know now that we thought differently about just a week ago?
Yes, and let me start by saying thank you, Milton. Thank you, WCSL, the media, for disseminating information. Thanks to Jeff and the city and all the emergency personnel, healthcare workers, people that put food on the shelves at the grocery store. There are a lot of people we need to be grateful to right now. So what's new with the virus? I'm going to cover this in 5 points. The first is sort of the question, when will this be over? And is it over? I ran into a gentleman this past week who said, well, we're just about over this thing, aren't we? And I said, well, no, not here, not in Cherryivlle, not in Gaston County. We may be in the second quarter, to use a sports analogy. There are places like New York City that may be in the third quarter, but we're probably in the second quarter. And we can talk a little bit about what the projections are for North Carolina and when it will peak here. In terms of symptoms, what's new? What are we learning? Initially, I think we all were educated as to fever, cough, and shortness of breath being the predominant symptoms to look for. We've learned now, since the pandemic has spread to our country, we've learned that there's some other symptoms that can be part of this. And we actually now know in hindsight that these were among the early Chinese victims as well. So gastrointestinal symptoms are more common than we thought. About a third, maybe a half of people with COVID-19 have nausea, vomiting, or diarrhea. We initially did not associate those symptoms with this. Pink eye is actually being more commonly described with this syndrome, and a loss of taste and smell, interestingly, has been recognized. And sometimes that's the very first sign of the disease. We can talk more about these symptoms. I would remind folks that if you have one of these, a loss of taste and smell, it doesn't necessarily mean that you have COVID-19. But it can show up in ways other than cough and fever. What about testing? I'm asked about that frequently. Testing is certainly on the increase. We've tested a lot of people in this country. Testing supplies and testing is still a limited resource. So I think the recommendation from the experts is still that if you have no symptoms or you're mildly sick with whatever, testing is not recommended at this time. I think in the next 2 to 4 weeks, testing will become more available because there are a number of companies working very, very hard to make it available. So at this point, the recommendation still is to hold off on testing, follow the advice of your healthcare provider, unless you're getting worse and worse. And then testing would be recommended, particularly if it's being considered that you go into the hospital. What about treatment? We can talk more about this. Hopefully there'll be some questions about treatment. Treatment still is what we call in medicine supportive care, managing the oxygen level, managing the fever, making people comfortable. There still is no proven drug. There is no vaccine on the horizon anytime soon. There are a lot of treatments that are being discussed, some controversial, and maybe we can address some of those in the next little while. And then lastly, what should we do right now? Should we do anything different? It does appear that social distancing and staying at home is working. It seems to be working in New York and other places. So we need to continue that. There was one new recommendation or suggestion this past week, and that is that if you go out in public, if you're around other people, it may make sense to wear a mask or some type of covering over your face. And that's not necessarily to keep you from getting the virus. It's actually intended if you have the virus and you're contagious and you don't know it. That is one way to prevent the droplets that you may share when you cough with other people. So this concept of wearing a scarf or any kind of protection if you're out in public is really to protect those around you, which the more we can reduce the spread of this, the quicker we'll get out of this this dilemma that we're in.
Again, we'd like to invite folks to give us a call if you have any questions for Dr. White or Jeff Cash, or any comment you'd like to make, any kind of question. We don't feel bashful or embarrassed to ask a question. 704-435-2844 or 735-8071 or 482-1390. Again, it's 435-2844, 735-8071 or 482-1390. Got a call coming in right now. Guys, y'all ready to take some questions? I hope this is a question. Hey, you calling to talk to our guest today? Okay, go right ahead.
Okay, I work for an agency where I have to hand the mail daily, open it up and distribute it. It's like reviews and stuff for like a big agent. How contagious is that? Do I need to wear gloves to open it up?
It's a very good question. So if you're handling mail and paper, how should you handle it? I think it would be very reasonable if you have adequate supply of gloves to wear gloves. There has been an observation that this virus can linger on paper for more than a matter of minutes or hours. So some recommendations I've seen have said if you receive a package or you receive mail, first let it sit, and then at some point wipe it down before you open it. So I think taking some precaution with incoming packages and mail does make sense.
Okay, so I like 200 pieces of mail a day that I open up.
That's a challenge. That is a real challenge. So it may be reasonable to wash your hands very, very frequently during that process, making sure you're not touching face, other parts of your body. It may be reasonable to open the mail if it's feasible. It may not be with your job, but let the mail sit before you open it. I've seen that as a recommendation. If you receive a package or mail, let it sit for a day. That may not be possible in your particular position.
So you would say wear gloves?
I would say wear gloves if at all possible, yes.
Okay. Yeah, they can furnish me some gloves. Okay. Thank you very much for your time and trouble. I appreciate you helping us.
Thank you for calling.
Yes.
Thanks. Bye-bye.
I appreciate it. All right, thanks for the call there. So there's a topic we don't hear much about is the handling of your mail. Not everybody gets 200 letters a day or envelopes a day like she does in the office, but at home you get a couple of bills or something in the mail or whatever. You need to think about that.
The experts also tell us, Milton, that it can live longer on metal and glass products.
Okay. All right, let's see if we have another call here. You calling for a question for the panel?
Yes, I am.
Okay, go right ahead.
I'm calling because I'm a little concerned with this stay at home. I'm seeing people on social media where they're going to the mountains, they're hiking somewhere, or they may be going to their neighbors and thinking that sitting outside is okay. And I'm wondering, is it okay? Is it okay for us to go different places? Is it okay for us to interact with others from a distance?
The order does call for total distancing of 6 feet for those social distancing, and that is allowed at some of the parks and some of the recreation activities. Most of the parks across the state have been closed, but they are encouraging that you still get some exercise. Now, as far as taking trips, that's discouraged unless it's for medical reasons or to care for a family member, and there's reasons for travel, but for the most part, you're encouraged to stay at home. And even walking through the neighborhood, as long as you maintain that 6 foot distance and don't congregate in groups, that's acceptable. However, the stay-at-home order is in effect, and it is a law. For the most part, law enforcement's going to educate you when they stop you, but they do have the power to write citations because it is a level 2 misdemeanor.
Okay, and what about if is it okay to go to your neighbor's or your family member's house and sit outside to see them?
Sitting outside would be better than staying indoors as long as you try to maintain that 6 foot distance.
So that's okay.
Yes.
So let me add from the medical perspective a couple of things. It's a really good question, and we are seeing that a lot. You see and hear people going places. The first thing I would tell you is think about traveling, particularly any amount of distance, and think about what would you do if you became ill? What would you do if you had car problems? Would you really right now want to be stranded or in a different unusual place 2, 3, 4 hours from here? Probably home where your family is, your doctor is, your familiar hospital is a pretty safer place to be right now. The second thing I would say is that we know viruses are spread a variety of ways. This virus is predominantly spread through what we call droplets, which are the larger pieces of particles of moisture that we cough and sneeze. And they don't travel 30 feet. Those droplets, that's why the 6 foot rule is in place. That's the predominant way we share this virus. The virus can be shared in what's called aerosol, which is the finer particles that can be sprayed much further distance across a room. But to reduce the dose of the virus that we're sharing with other people, that's why the 6 foot rule is in a place. That's why the mask, the scarves, the bandanas are in place. So having a get together with your neighbor, sitting out in the yard, 8 to 10 feet apart, that seems like a reasonable, safe thing to do based on what we know about this virus.
Okay.
Okay, thank you.
Thank you so much for calling. Appreciate the call. And if anyone else has a question for Dr. White or Jeff Cash here this morning, we'd love to hear from you. 704-482-1390, 735-8071, or 435-2844. Good morning. You got a question for Jeff or Dr. White?
Oh, I thought it was Swap Shop. I'm sorry.
No. Swap Shop's getting preempted today by a little bit. Guys, y'all got anything swap shop related? No. We're here on a much more serious matter today, and we are discussing the coronavirus, COVID-19, as it were, and taking your questions plus providing information as we go along. Are you calling for the question to the panel?
Yes, I am.
Okay, go right ahead.
Dr. White, I keep seeing on the news and at the press conferences them talk about a medicine called hydroxychloroquine, and it seems like there's a lot of debate around it. Can you speak on it a little bit and maybe what we know, what we don't know?
I will, and thank you for asking about that. Hydroxychloroquine and its related drug, chloroquine. The hydroxychloroquine is also known by the brand name Plaquenil, which a number of people have taken for conditions like lupus or rheumatoid arthritis and some of the chronic arthritis conditions. So these drugs have been around and available and used in medicine for a long time. Initially, we had some evidence from a small study in France that suggested that hydroxychloroquine combined with an antibiotic, azithromycin, seemed to be effective in shortening the duration of this illness and helping people get better faster and reducing deaths. So that's where it got its initial interest. There was a study that came out a little later that actually was from China, from some of the early experience. As you know, the virus was first identified in Wuhan. So this second study using hydroxychloroquine did not show any benefit. There's certainly a lot of controversy about it. If it possibly works, shouldn't we be using it? And I think the scientists have taken the position that we don't know enough. We know this is a drug that should not be taken lightly. There are potential heart problems, not just side effects, but serious side effects. And so we just don't have enough data. The competing argument is, well, if it possibly helps, why not use it? What do we have to lose? And in someone who is near death in the intensive care unit, I suspect it is being used and it's being tried. I think we have to be very careful. We have to make sure as best we can, and we have limited knowledge now, do the benefits outweigh the risk? And in someone who is critically ill, then I think we may look at as the potential benefits outweigh the risk. In someone who is not sick or mildly sick, I don't think we have enough data to say that the benefits would outweigh the risk right now. So it's a very good question. I certainly think we need to make sure that that drug remains available. It needs to remain available for those patients who have lupus and those conditions, because they are very dependent on this medicine. And it needs to remain available for the right patient with COVID-19. I do want to make one point that has not been stressed, at least in the general media about this, and that is I communicated with an emergency room doctor in the Northeast just recently, and he made the observation that they have patients with lupus and rheumatoid arthritis and who are taking hydroxychloroquine. They're still coming down with this virus. They're not seeing that these patients are totally protected. They're getting sick like everyone else. So I think we need to be careful not to prematurely assume that this is a fully protective drug and everyone should be on it.
Okay.
I hope that answers your question, sir.
Yeah. Thank you so much.
Thank you for coming. Appreciate it. Yeah, there's a lot of questions we could ask about, work being done for a vaccine or a something to give after someone has it as a cure for COVID-19. A lot of questions could be expounded upon on that subject. In addition to the drug you just spoke of, other drugs I've heard brought up, and new drugs altogether. I think we have a caller here, and then if they don't ask the question I'm thinking of, we'll come back to it. But let's go to this caller. You calling for the panel to ask a question?
Yes, I am. Thank you.
All right, go ahead.
Dr. White, I was curious about two different things. One, if a person has had a lobectomy, how does that put them at higher risk? Seems like probably a little bit of common sense, but also, what about a diabetic? What makes a diabetic at a higher risk?
Two very good questions. So what about a patient who has had a lobectomy? For those of you who might be unfamiliar with that term, if they've had a part of their lung removed, what would that do as it relates to this virus? And then second question, what about a patient with diabetes? So I would answer that the following. I think that if you have a part of a lung removed, a lobe of the lung, it reduces your lung capacity, first of all. And so I would think that would put that patient at some increased risk were they to develop the more serious stages of this virus. They may require more oxygen. They may require more assistance breathing. They may require being on a ventilator sooner. I would also say that it would be important to look at perhaps why the lobectomy was done. Was the person a smoker? If they're continuing to smoke, did they smoke for many, many years and have some established emphysema, even if they've quit smoking? So if this was a lung cancer after 30 years of smoking, that should be that would add to that person's risk. As far as diabetes, we always consider diabetes as an increased risk factor for infections of all sorts, viruses and bacteria. I think the thing about diabetes that is probably important is not just how well the diabetes is controlled, but what company does it keep. So most people with diabetes also have high blood pressure, and many people with diabetes have heart disease. And we know from the early observations in China that for whatever reason, high blood pressure seemed to be a risk factor for complications from this virus. And heart disease, if you have established heart disease, that is a risk factor. So the diabetes is important, the glucose control is important, but it may be the company that the diabetes keeps that might be even more important: blood pressure and heart disease.
All right.
Thank you so much, Dr. White.
Thank you, and best wishes.
Mm-hmm. Thank you for the call. I understand. I realize, a lot of people are listening and maybe they can't call in right now for whatever reason. Well, you can text if you have the opportunity. You can text 704-473-2794. And you can text that number and ask a question. But we'd like for you to call in on the show if at all possible. We'd like for you to actually call in. But if you can't make the call live on the air, you can text 704-473-2794. We got another caller standing by, I believe. Are you calling to talk to Dr. White or Jeff Cash?
Well, yes, I'm calling regarding to the comment a while ago regarding to the mail. As I just went to the box, and I'm just concerned and everything, with bringing it in my home and handling it and everything. And, of course, I have health issues with the lungs and so forth. What should I do? I mean, should I just leave it in the mailbox for a couple of days?
So, really good but difficult questions. I would first say, take a step back and look at risk and look at all the risk that you may be exposed to. And think about the most risky situations. It's close contact with people. That's the number one risk to worry about. The second is surfaces, as Jeff mentioned earlier, countertops, metal, copper, doorknobs. Those need to be cleaned and disinfected often. So there's going to be less risk from paper, from cardboard, than these other face-to-face interactions and other surfaces where the virus might live for a week or two. That's why they need to be cleaned and disinfected so more often. So put it in perspective, first of all. The previous caller who talked about opening 200 pieces of mail a day, I mean, goodness, that's a challenge. I don't know that I've encountered that yet. So that requires some special thought. I think, as far as your mail and your mailbox, I think it'd be certainly reasonable to wash your hands thoroughly. If you have gloves, wear gloves. If you don't, bring the mail in, wipe it down without damaging it with some type of Lysol wipe, and then maybe let it sit for a half a day. All those things reduce the dose, and that's the thing I think we need to keep in mind is contracting this virus is very dose related. So coughing in one's face is highest risk. Coughing 4 feet away is less risk, 10 feet away is less risk, surfaces would be less risk, paper and cardboard less risk. And it's really hard to totally eliminate our risk. Very, very hard. I think what we actually hope is that maybe and gradually over time, everyone will be, until we get a vaccine, is exposed very mildly to this virus. They develop immunity, and therefore they won't be able to catch it second time around or next year or 3 years from now. So I understand your question. It's also very easy to get incredibly paranoid right now and almost feel paralyzed as to what to do. So you do the best you can. I wish we had all the answers. None of us have practiced this particular virus before. We don't have a good rule book to go by. So we're learning a bit as we go. So again, my advice would be think about the dose that you're exposed to. Try to minimize that, but don't become so handcuffed that you can't function.
Okay. All right.
Because I'm just concerned, because like I said, I was listening, of course, and I went and got the mail, and then I hear that, and here I've just brought it in the house, and I thought, well, I best better call because I was having the health issue, because I'm one of them grannies they talk about where, 60 and over and being careful. And so I'd hate to, be bringing something in the house and then I could have left it in the mailbox.
Yes, ma'am. And thank you for being a grandmother. And my advice would be, you've already done that, so wash your hands. Wash your hands frequently. Stay away from your face. And you've done the best you can.
Yeah. No way.
Yes, I keep the soap real handy. Yes, definitely, because I have to with everything. But I appreciate y'all's help. So more or less, what you're saying is, as long as everybody washes their hands, don't touch their face, think about what they're doing, and staying away and doing the distance and things, and let this thing skedaddle out of here, we should be okay. But just be careful and make sure to keep everything sanitized. And, of course, like when you do bring them in, like me, well, then just slightly wipe it off and go with that, and then, of course, clean your surfaces afterwards, right?
Correct.
Yeah. All right. Thank you, Colin. Appreciate that. Jeff, I think this text question might be for you and or Dr. White, too. When do you feel like physical distancing will be lifted? And let's see. Let me find. I've lost my place. When do you feel like my old-timey phone is hard to read long text off of. When do you feel like physical distancing will be lifted and non-essential businesses would go back to work? What's your opinion on that?
Well, I can give you an opinion, but I can also tell you what I'm hearing from the experts is that we know the governor's got the stay-at-home, the business is closed through the end of April. It depends on how much by staying at home and social distancing and washing, we flatten that curve that they've been referring to. Mm-hmm. And that was basically designed to keep the hospitals from being overwhelmed. Mm-hmm. And you can see for what's going on in New York City with the Navy bringing in a hospital ship, Samaritan's Purse setting up hospital near Central Park. It's overwhelmed by hospitals in New York City. That's what we want to try to avoid with the don't go to work and stay at home. The end of the month is the governor's projections, but we have heard that could have to be extended based on the data at hand as we get deeper in the month of April.
Okay. Dr. White, any comment on that question?
Right. So when are we going to be able to relax this social distancing and allow non-essential businesses to get back to work? I think one particular issue that has not been addressed enough, and that is this whole issue of immunity. I don't think we should expect a vaccine for a year and a half. Vaccines are very difficult to design. They're very tricky, and they take considerable time to find out if they work. So the key, I think, is going to be when we start identifying people who have had this virus and are immune. And that's going to require an actual blood test to check for what we call antibodies. And once we're able to identify people who have protective antibodies and it doesn't look like they're getting sick again, that looks like they're protected, just like they had a successful vaccine, then I think we can start loosening up a lot. Those folks can actually go into potentially a hospital and care for someone who's sick. More and more people could go back to work if we knew that they were safe, that they didn't have the virus, and more importantly, that they were protected if they came in contact with someone. So this whole idea of immunity and checking for antibodies, I don't think enough, all these components are important. Treatment, drugs, do I have the virus or not? They're all important, but this particular topic, who is immune, has not been given enough attention. And my hope is that companies are working furiously to make those antibody tests available in large quantities, because I believe that will be the proof that folks can begin to go back to work much sooner. And clearly that needs, at some point, it needs to happen for our economy, for our businesses, for everybody's financial and mental well-being.
Okay. Another text question here. Let's assume there is no vaccine this winter. What happens to you just may have answered this. What happens to schools or businesses this fall/winter that are back in session and an individual is diagnosed with the virus? Will there be a complete shutdown of business and or schools, or do we just keep going and hope for the best?
And we just have to wait and see what the data tells us, Milton. Every day that we go through this crisis, we learn more and more each day. The experts are on top of it. It's an all-out fight by the Congress, by the President, by the state of North Carolina, Gaston County, and even to the city of Cherryivlle. We're throwing all our resources at this like it's an enemy that's invaded our coastline. And the more time passes, the more we'll be able to answer those questions. But right now, we're still in a holding pattern. And Dr. White may be able to address that as well as returning.
So a number of experts have predicted or at least worried that this virus, if it does calm down and seemingly go away this summer, that it may come back in a second wave this winter. So that's a big concern. Now, what we hope is that this virus might change or mutate over time. So if it does come back, so to speak, in the winter, it has changed or mutated so that it's not as harmful or deadly second time around. So I said earlier that we don't have any practice with COVID-19. This is new. We have some viruses from the past that we can look at and try to learn something from those previous experiences. But again, none of those are identical to this at all. But if you go back to 1918 with the so-called Spanish flu, that virus lasted about 2 years. It came about a fourth of the world population was infected. 100,000 more or less people died. The world was smaller at that time, population-wise, remember. But that virus mutated. So it lasted a long time, and then it finally changed. It mutated, so it became virtually non-harmful, and it went away. It went away abruptly. Now, I don't think we can rest on that assumption that this one will, and the experts are warning us. So I think, as Jeff said, important thing is I think we're going to have to be extremely vigilant and continue to watch what this virus does and what it does in parts of the country that right now haven't experienced it. We'll need to watch those parts of the country to see if it shows up later. So I'd say be hopeful, but vigilant.
Again, anyone would have a question, 704-482-1390, 435-2844-735-8071. We're with you till 11:30 today, and you guys will be back next week also. So we'll see what transpires in a week on next Tuesday. But if anyone has a question for you today, and keep in mind they will be back next week in case you have another question at that time. Subject you maybe not have heard anybody talk about much, or maybe you have, because we hear all kind of things, and there's always the conspiracy theorist out there. What's the chances this was cooked up by an enemy to America? To just put it plain and simple.
I'm not much of a conspiracy theorist person, but there have people lost loved ones, and people have passed away. Healthcare workers, firefighters, police officers have this disease now, so I don't think it's conspiracy. I just think it's one of those things that we have to deal with, and it is what it is.
Mm-hmm. Dr. White?
I think experts do believe that this virus originated where it was first identified, and that was in Wuhan, China. The belief is that it probably came from a so-called wet market there, and likely from a bat. Now, we don't know whether it was transmitted from a bat to another animal and then to the humans, or directly from bat to human. We don't know. But if you look at the genetic code of the coronavirus that lives in bats, it's almost identical to the genetic makeup of this coronavirus that we're dealing with. Mm-hmm. There have been rumors and discussions, and I'm sure this is where your question comes from, that perhaps this was a virus that escaped from a laboratory, mm-hmm. or planted in the population from a laboratory. I don't think there's evidence of that, and I think serious scientists do still believe that this originated from the animal world and was transmitted into the human population, and we believe it occurred most likely in one of those wet markets, which have been and are a source of human disease.
Okay. All right, got a caller standing by. You calling to ask a question?
Hey, Milton, this is Steve Evans.
Hey, Steve.
Just wanted to let you know, or say a comment here to Calvin and the radio station, and you're doing a great job in this interview, and all the people there that are very, very helpful and very informative. And I just want to thank you for doing that, and for all that are there, and I hope y'all have a great day.
All right, Steve. Thank you, sir. Appreciate it. Steve, one of our regular listeners from the south end of Gastonia town there. Let's talk about, now, is it Gaston County has now 2 deaths, Jeff?
Yes, there's 2 deaths been reported in Gaston County. Mm-hmm. There's 46 total cases that the county's been dealing with over the whole time period.
Is it just a thing of how things are reported in some counties as opposed to others, or is it all the same in every county the way things are reported? But Lincoln County kind of stands out as, some effect. No deaths, fortunately, there. But then you've got Gaston County bordering Lincoln, you got Cleveland County bordering Lincoln, and they all have much higher incidence of positive cases. Lincoln County's got the positive cases, but 5 of those 9 have recovered. Is there a reason for that difference you can think of?
It's an important question. If you go to the North Carolina Department of Public Health, pretty sure that's the right website, there's a map that shows from the first cases that were identified in North Carolina and what's happened every day. It's a map of North Carolina, and every day as the as the narrative shows you, how it started, first identified in the Raleigh area and then Charlotte, and then how more and more cases have been identified and it has spread. And every day you can watch that, and it's spreading more and more. So where we think, I think Jeff said earlier, 89 counties have been affected. The number of cases in all those counties, in the Raleigh area, Durham, Charlotte, they're becoming more numerous, and then it's spreading to all the other counties. I doubt a county will be spared from this. It is also important that remember that testing varies from place to place. So if you're in a county or a state or a country where more testing's being done, it will look like there are more cases. So there are a lot of people who are untested. So we need to remember that when we assume that, well, there's more of this virus in this county than that. It may be a matter of how many people have actually been tested.
You might get a false sense of security because of some of the areas that's not tested as much. We have a caller standing by. Oh, caller couldn't stand by. So call us back, please. Sorry to lose you there. 704-435-2844, 735-8071-482-1390. And we've got about 12 minutes or so left with Dr. White and Jeff Cash, and here on WCSL. We will be back next week, the same time period, 10:30 to 11. But go ahead and give us a call today if you have a question today. You may have a totally different question next week because of something we've learned in the next 7 days. The game changes, the rules change to this crisis as the hours change. Gentlemen, it's just there's no way to really say what we may be up against at this time next week. Grab this phone call. Good morning. You calling to talk to Jeff or Dr. White?
I have a question about some supplies for Dr. White or whatever.
Okay. Go right ahead. You're on the air.
This is Kenneth Drigg, and I'd like to find out. My wife has a lot of immune problems, and I've been trying all over town and all drugstores to find hand sanitizer or face masks. They say I cannot get none from any drugstores or whatever because they have to go to the health facilities. How are we supposed to help protect ourselves? And I understand the little mask that you put over for yourself that keep from spreading. But how can we get something when they have to go to hospital or to the doctor's office like she has to do a lot? Thank you.
Good question, and I feel for your situation. Hope she will remain well. It is it's a challenge. So we have millions of masks that are being made per day and being shipped and made available. You are correct. Up to now, it's been recommended that healthcare workers, emergency workers, hospital individuals be given priority for that personal protective equipment. And that's not my recommendation. That's from up above. That's from the experts. My feeling is that masks will become more available. I would stay tuned to that. Hand sanitizer. I think what happened is that, we exhausted our supply. We didn't know to be ready for this, and so there'll be a second wave of hand sanitizer available. I hope soon. I hope very, very soon.
There is even several breweries in our part of the state that have switched from making alcohol to making alcohol-based hand sanitizer. Like Dr. White, I believe by the weekend there'll be another load, if you will, or another restocking of shelves, especially for the hand sanitizer, is what we're understanding.
And sir, let me add that in a primary care office like mine and all the others I know, they don't have N95 masks. They don't have gowns. They don't have enough gloves. We don't have what you need either. And it's very unsettling. And while I may not be dealing with the same worry as you are with your wife, we don't have a storeroom of these N95 masks or any mask either, and we can't get them. So it's not like we're hoarding them in our doctor's offices. They are being allocated to the highest risk and the most dangerous situations right now. So we don't have them either, and I hope we will.
All right. Thanks, sir. Appreciate your phone call.
Thank you.
Yes. All right. Got a question coming in here via text. Is the city, meaning Cherryivlle, monitoring public spaces such as grocery stores, restaurants, etc., as to adhering to the guidelines?
Yes, we are. Our police department has been given the direct assignment of monitoring that. The first level is education. If they see people congregated or somebody breaking the rules of stay at home or while their business is open, etc., they'll go in and they'll educate them to how critical and how important it is to close or to not meet in those larger groups. If they have to go back the second time, they will receive a citation, which is a level 2 misdemeanor in North Carolina.
Mm-hmm. Okay.
I was at my office looking out the window yesterday, and a group of about 5 teenagers came walking down Main Street, and they were all walking within 2 feet of each other. They ran into someone else who was walking a dog. They all stopped to pet the dog. So here's a group of now of about 8 people all together, side by side, petting the dog. I totally understand it. This is not meant to be a criticism of the youth. I wish I were young again. But I think there is a tendency among young people, and we were all one at some point in time, of feeling that we're invincible, that nothing's going to happen to us, that this is a virus of the elderly or some other country. And I would urge everyone, young and all ages, to remember that the social distancing is important. So, and that one in that group of 8 may have been contagious, didn't know it, and now there's been a significant dose sharing of the virus. So those 8 now may go out and infect 30 other people. So we can't get complacent. We can't get cocky. We can't think we're invincible. We have to think about ourselves, but also other people. And that's really unnatural. It's totally natural to stop on a sidewalk to pet a dog and talk to somebody. This is just now when we shouldn't do that. This is a critical couple of weeks. Jeff can address this better than me, but projections seem to be that it may be that around April 15th, April 16th may be when this virus peaks in North Carolina. It's really important that we continue to do what we're doing and do it even better. And Jeff, is that about what you're hearing and seeing too?
That's the predictions, with possibly another 4 to 5 days added on to that original guess through the data that's on hand.
Last week, one of the topics we hit kind of toward the end of the interview and was the topic of how do I know a seasonal allergy? This is allergy season. How do I differentiate? It's just my allergies as opposed to, oh no, I may be getting sick with COVID-19. How would you differentiate?
Yeah. So how do you differentiate other illnesses from COVID-19, including seasonal allergies? This is a heavy pollen time of the year. So that's important. I think first thing we need to realize is that we're all hyper sensitive and paranoid right now. And the first scratchy throat we all get we think this is it.
Yeah.
So it's understandable. So I think first of all is go into your memory bank and think, okay, have I ever had allergies? Have I ever had them around Easter? What did they feel like? Does this feel like that? If it feels like that, it probably is. Mm-hmm. Second, what does it respond to? If you took an over-the-counter antihistamine and 6 hours later you feel better, it's not likely to be a case of COVID-19 with symptoms. Mm-hmm. If you get a fever, it's more likely to be from something else. It's also important to remember that not everyone with COVID-19 is going to have a fever. Mm-hmm. If you get a cough, it's more likely this time of year to be from the pollen. If you ache all over, that can happen with allergies. It could happen with a common cold. People still get a common cold. They still get strep throat. You still have the other things that happen even during this pandemic. Now, it is important, I think, to realize that if you have a severe flu-like illness, aching severely from head to toe, headache, fever, cough, it's probably not influenza. Influenza seem to dissipate probably in February. There may still be some cases because there are actually cases all year round, just not as many. So if you're really sick with those symptoms, I would certainly not blame that on, well, I've got the flu, not this COVID. I think that's where you'd want to contact your doctor or healthcare provider to get further advice.
And it may be comparing apples to oranges, but taking the flu shot this year, would that have any effect at giving you any immunity against COVID-19?
To our knowledge, there's no cross protection from receiving the flu vaccine this year. The flu vaccine can be effective. It has been more effective certain years than others, but the viruses are from two completely different families. So you may have protection against the influenza virus, but you wouldn't have protection against this virus, which is from a completely different family, the coronavirus family.
Well, we're going to be back next week. We're just about out of time. Gentlemen, any final thoughts before we wrap up today?
Bill, and I'd like to say I'm sure there's plenty of folks in your listening area that's concerned about and got questions about the CARES Act that's coming down from the federal government for individuals and businesses, as well as how it can help small business, large business, employment issues. That guidance is being rolled out daily. By next Tuesday, we should have more information to share with your listeners about the CARES Act and other financial opportunities that's going to be available to businesses, especially small businesses.
Okay, Dr. White?
Final words for this week. We are entering a very crucial phase. Don't get lazy. Don't get overconfident. Continue to be careful. Continue to take good care of yourself. Really, really take care of your mental health, whether that is through telephone calls, through other communication means, whether it be prayer, whether it be sitting 10 feet apart from a neighbor and talking in your front yard. Try to relax, try to sleep, eat well. This will be over one day, but not soon. Don't let up right now.
Yeah. All right. Very, very well spoken. Thank you, gentlemen. Jeff Cash with the City of Cherryivlle, City Manager, and Gaston County Emergency Management Team. Dr. Tom White also with us today from Cherryiville and expert on this virus. So we thank you very much, folks, for your calls, your questions, your text, and we will be back next week. We can do it all over again. Different questions, different information may be available at that time next week. You may have some better news to report, or may go the other way. We hope you'll join us again next week for the next program from 10:30 to 11:30 here on WCSL 1590 AM, 92.3 FM, and KTCBroadcasting.com. Until then, we'll see you here 1 week from today on the Community Profile. Coming up later on here on WCSL in about 30 35 minutes rather, the Community Holy Week services, a live broadcast from First Presbyterian Church of Cherryivlle. And because of COVID-19, those services are being held in a different manner, and there is no congregation and no meal afterwards, but they are on radio, so you can listen in to the services this year. And that'll start about 12:05 this afternoon.